Good morning, everybody. We're here at Grain and Berry, as you can see, and I am here with Tarah Savino, who is a physician's assistant at A to Z Pediatrics.
Yes.
And we really wanted to just come this morning to talk about, this is such a strange time. I'm sure you're seeing that with the families you speak to. For our kids, I know our anxiety is high. And sometimes we forget that our little ones have that anxiety as well. And we're trying to keep them safe and we're trying to keep them happy. And so we just thought it'd be great to talk to someone who talks to parents and kids all the time, not just about how you're doing in the hallway, but about their health and about how they're feeling. And Tarah, of course, always comes to mind because she's given us such great tips in the past. So we're just going to talk to her and ask her a couple questions, and I think we'll get some good advice and some good tips from Tarah. So thanks for being here, Tarah.
Thank you for having me again.
We are so glad. And Tarah is a parent as well at Day Spring of two amazing boys.
Thank you.
At the Jazz campus.
Yes, which we all love.
Which is great. So thank you. So we're just going to start out, and by no means are we saying that you have to be the expert in this, but you hear a lot from families. So
absolutely.
We just wanted to know, like, what are some ways that our parents at home can support their children's mental health while we really are, all of us are feeling kind of isolated?
Yeah, definitely. I think keeping a sense of calm at home has been challenging for a lot of families because there's a lot of fears with the unknown around the pandemic and the virus, and because it's all new, none of us have ever experienced this before, and I think social distancing and isolation has been challenging for a lot of children and families and parents, and so that's led to some challenges, and I feel like children need to feel safe and protected, and they need to understand their emotions in order to be well all around. And I think that begins with parents or caregivers. Yes. And so a couple of the things that I think that we can do to help keep this sense of calm and to help them work through this trying time would be, one, to address their fears straight out. And it's okay for children to hear about things that are scary. It's okay for them to understand that people are getting sick and that people have died and that there's risks in what was once normal going out. There's risks in that, but we can also help them understand ways to protect themselves and give them the power to understand that they'll be safe if they take these simple precautions, mainly hand washing, wearing masks, and doing their best to social distance when it's appropriate. I think explaining to them that this is just a germ like other germs. Right. And that they don't have to fear it, but just help protect themselves from it. And so those are all important points. Also, like you talked about children being anxious, that sometimes manifests into different emotions. And so recognizing and validating their emotions is really important. And telling them, I relate, I feel anxious too sometimes when I see people in masks, or I know it's different now because school looks different, or the grocery store is different with different aisles that you can go up and down. That makes me uncomfortable too. So them knowing that you're relating to their emotions will help them understand that it's okay. And then reassuring them, we can work through emotions by doing different things. When I feel anxious or sad, or sometimes I take big deep breaths. Sometimes I put a movie on that makes me feel happy. Sometimes I go play with my dog because that brings me joy and happiness. So give them those mechanisms to cope and to work through their emotions, which they probably haven't had to do, or if they have, maybe they didn't know the best way to go about it.
Sure. One of the things that I thought was really neat, there's a reason why we have fairy tales, and that's because kids want to be able to actually talk about their big giants or their something that is something big that they want to hear about someone overcoming. So allowing our kids to play things out, to like, what if I got, instead of us shutting them down, like, you're not going to get it, wash your hands again.
Right.
Let them, well, okay, so if you got it, then we'd go to the doctor, and this is how we, kind of let them talk that through.
Right.
They might come up with some fantastic stories sometimes, and you're like, oh, okay. But that's really them just, that's how they're working through that too.
Right.
So And answer. I love that you say just answer their questions realistically.
Yeah.
Like that'll never happen, honey. That doesn't help.
Right.
So really giving them that real answer and that little solution that they can have as well. So thank you. I think that's great.
Good.
So this has been a hard one because social and physical activities are so important to our kids, and everything's closed.
Right.
You know, I mean, we've got our little things here and there
Right.
open. So, what activities are safe? Do you have any guidance for us on that?
Yeah, absolutely. So we all know that social interaction is paramount and really important as far as children's well-being, mental health, development, and like you said, everything's different now and changed. We are really fortunate that we live in a day and age where we have technology that allows us to keep in touch with people across the country or next door without becoming face-to-face with them.
Right.
So utilizing the different apps or platforms like FaceTiming, Skyping, there's different fun apps that I found that we've used with my children called House Party, which is it's essentially FaceTiming, and you can play games, so it's entertainment. You could play Heads Up, you can play Uno, you could play Pictionary.
With people who are in a different location.
Exactly,
right?
with their friends who they haven't seen because it's, you know, we've all been in quarantine, or with cousins who we haven't seen because they're in their home staying safe. So utilizing technology to maintain social interaction, I think, has been really important. It's still safe to go outside, and it's really important that kids get that time to be kids, to be outside and still feel safe and are able to have fun and enjoy. In Pasco County, we have a lot of different parks that you can utilize to go bike riding, to go on nature trails, to go kayaking. So all of these activities that maybe you didn't have time set out before to do, you should look into doing them with your families because they're free and fun and
Fresh
safe.
air.
Yeah.
It's so good for them. They'll sleep well.
Yeah.
And that's really important.
One other thing I wanted to talk about, because I do get this question a lot in practice, are parents of children who are concerned about return to extracurricular activities like dance or baseball or basketball or football. And I also wanted to mention that the American Academy of Pediatrics has just hundreds of really great articles about all things COVID and how to keep your family safe. And if you visit healthychildren.org, you can access all of these articles for free, and they're really great. But youth sports is kind of tricky, and it's all about what each family feels comfortable doing and what's best for each family, because all sports are not created equal and there's different types of sports. But some of these sports that are considered less risky would be obviously sports that are played outside, sports where children aren't coming in direct contact with each other but can remain 6 to 8 feet apart, don't require traveling outside of your community, so you're kind of staying around the same group of people. You're not going to areas in the state where the cases are much higher, and that allow children to still maintain and wear masks while they're participating, and that have smaller teams, so less than 10 people on a team. So all of those are things that maybe you can consider. If your child's sport kind of fit into that, then it may be safe for them to participate while still practicing safe measures.
And that's great, because it really is important for them to run and you know, and have those activities and just to be around people. So we can do that in a safe manner, which is great. So so we do have I have 5 kids, and some of them don't worry at all. And then some of them just like, that's all they do. Like ask the question, all the questions of what about this? And what if this happens? You're like, really? But you do have those ones that just have that anxiety and fear. And some of that comes from us and the modeling that we do as parents. And so we have to remember, why is my child so fearful? Well, we kind of look in the mirror sometimes and say, well, it might be because I'm so fearful. But if you have that child who's having that anxiety during COVID, you know, do you have something that can speak right to that? Yeah,
so I think, like we talked a little bit about, if you're forthcoming with the facts, that children will respond better to, you know, some of the scenarios or situations that they're put in. So we know from the past year of science and statistics that children are less likely to become infected with a coronavirus. So that's a really excellent positive thing that we can all focus on. We also know that when children are infected, in most cases it's a less severe infection, and often children and families don't know that the children have it unless they test positive. So these are all good things. We never want to see sick children. We always want to prevent children from becoming ill or having health issues. I think giving them that information is beneficial, and it will help put their minds at ease. The other thing I would say is give them hope. If they know, oh well, if I go to school and I wear my mask and I wash my hands before I eat and after I go to the bathroom and I maintain safe distances from others, and other children don't come to school when they're sick, then I should be okay. And if you continue to remind them that throughout, the past year and months to come, that it will help with anxieties. And then lastly, like you said, I think leading by example is so important as parents. They look at us for reassurance, they look at us for safety, and if they see us affected in negative ways and feeling more stressed over certain things, they're going to inherit the same attitude towards it. So I know there's a lot of controversy over wearing masks in public and whether or not you should, but the evidence and the science is showing that it slows the spread of the virus if people wear masks in public. So if you can do anything for your child, it's give them that piece of advice that we're doing this for ourselves and for others to help prevent this virus from becoming worse.
I like that you said the word hope, because that's such a positive word rather than fear, which is such a negative word.
Yeah.
Just giving them that we can live.
Yeah.
We can still do things, and just that hope of life doesn't have to stop. So kind of along those lines.
Right.
Remember normal.
Right.
Because it seems so far away.
I know.
Is there some way we can have a sense of normalcy during this when things change every day?
Right. So I think that as caregivers and parents and educators, recreating things that are normal in our new normal way is really great for them. And I think back to something that Dayspring did during quarantine, where you did a virtual talent show. And my son had missed a piano recital, which he had looked forward to for so long. And often children prepare for recitals or tournaments or dance shows, and they prepare for all these things that they felt like they missed out on. And so giving them new normals, like giving them virtual talent shows, or like even as far as we don't get to go out to eat anymore, I miss that. Well, let's order Chili's in tonight, and that was your weekly routine. Keep that weekly routine, but do it in a different way.
Great idea.
And then I think, like, as far as the major things like vacationing, there's different options. Like, you can't go on a Disney cruise this year, but we can go camping and go kayaking at a state park, and maybe that'll be our vacation this year. Look for ways to give them, fun things to do that are safe and following, the proper safety measures.
I think that's important during this season that's coming up. So Thanksgiving and Christmas, and we can't do normal. So every year we do blah, blah, blah. Being parents that get ahead of that and say, well, every year we have a cookie contest, but grandma can't come, and so how else can you do that? Can you do that on House Party, where everybody makes cookies at home and then they taste them, or they send them to drop them off on the doorstep, and then you taste them in front of each other? What are the things that you normally do? And then I love that you say, let's order in Chili's. Maybe the kids can decorate the dining room like Chili's, and it sounds silly, but it's something that's fun.
Yeah.
It's something that feels almost normal, like we went to Chili's tonight.
Right.
It was our version. But that's going to be important during this holiday season, where we know that depression is up.
Yeah.
And we think that doesn't affect kids, but it does.
Absolutely.
So how can you recreate? I love that. That gave me like 700 ideas. But that's what my mind does. But I think that's great. So let's talk about hand washing. You've mentioned that a couple times because we know that is so key. Of course, having our masks. and then also hand washing. So are there some tips you can give us to get those cutie pies to be washing their hands more, and any other like hygiene tips you could give us?
Right. So hand washing remains the most effective way to prevent the spread of disease for any disease. And so it's really important that kids are doing it and that adults are doing it as well, and that they're doing it right. So the CDC recommends that people wash their hands before preparing food, before eating food, after using the restroom, after a cough, a sneeze, after blowing your nose. And now in COVID world, whenever you come home or in a public place, after you're in a public place. And especially now when you're touching high touch areas, doors, gas pumps, because we know that this virus can survive on surfaces, and so it's really important that we're washing our hands. And as far as proper way to wash hands, it's always better to physically wash your hands with soap and water as opposed to using sanitizer, if that's available. So when we're in school, we'd rather have children, or if you're in a workplace, we'd rather have adults physically washing their hands with soap and water. But if that's not available, if you run to Sprouts and then you're in your car, you should sanitize your hands.
Keep it in your car.
Absolutely.
In your purse.
Your backpacks, wherever you can, because it's better than nothing. So as far as physically washing your hands, you should wet your hands first. You should lather with soap. You should then scrub your hands, top, bottom, in between your fingers, sides, under your nails if you need to, for 20 seconds, or 2 happy birthday songs. That's the trick we teach kids in the office. And then rinse thoroughly and dry. So if you follow those 5 steps, then you've done an excellent job at cleaning your hands and preventing the spread of infection.
Wonderful. And for somebody who's a little bit of a germaphobe, I'm so happy that the whole world has to wash their hands more now.
Yeah.
And I'm one of those people who never touch door handles or like the banisters in public places, like going down to a subway or something. I was always like, kids, don't touch the banister. Why? I'm like, because we have no idea who does that. So we can teach our kids little tiny tips that, I've lived my whole life like that.
Right.
So everyone's just joining my world.
And I will say that it's working because we are seeing a lot less flu than we have ever seen in recent years.
I was wondering that. So, okay,
so in our practice, we're seeing so much less flu in children, and in part because of masks and lots of hand washing and socially distancing. I did want to speak about masks because I've had a lot of parents say, well, do they need to wear masks? Where should they wear masks? The Center for Disease Control recommends that adults and children over the age of 2 wear masks anytime they're in public places. So essentially around other people outside of their home. My boys, they're so accustomed to it now that when we go places, they're in the car, they'll put the mask on. I'll say, well, you can take it off in the car. You don't have to wear it now, but they're used to it, so it's good. But the reason that children under 2 aren't required or recommended to wear it is because of the risk of suffocation. And there's very few exceptions for adults or children with physical or mental disabilities for the same reason. If you're not physically able to remove your mask, then it's more of a risk for suffocation. So that's the reason it's 2 and up. And then as far as the type of mask, it's sufficient for people to be wearing cloth masks that can be washed. The higher grade hospital and medical masks should be reserved for medical professionals, the N95s, the surgical masks, unless for some reason you or your child has, some immune deficiencies or you have a medical condition that your doctor states otherwise.
Okay, great. Thank you. That's excellent. All right, so can you give our families maybe, we've had to change a lot in our lives, but are there like top 3 things like right now that we could change that could just kind of maybe be the needle, pushes the needle a little bit more to make our family a little bit safer?
Yeah. I think if you hadn't lived a relatively healthy lifestyle prior to, this would be a great catalyst to make some healthy changes in your life. Physical activity, exercise, healthy diet, eating more fruits and vegetables, drinking more water, taking a multivitamin every day, getting a checkup with your doctor annually to make sure everything else is okay, because a lot of things have been ignored during this pandemic, and people have been avoiding doctors, which we should continue to do because they're practicing the same safe measures that the rest of us are. And children with vaccines, the flu vaccine is important every year. It helps keep children out of the hospital and prevent deaths. So those are really important too. The next thing I would say would be, in prior years and in the past, when you were sick, you were often, our mentality was, well, I can tough it out. I can still go to work.
I'm guilty.
I can still go to that meeting, I can still run to the grocery store or do what I have to do. For everyone and for yourself, the best thing to do, the best change to make would be to stay home until you know that you're better, you're symptom-free, you've had a negative test, because those situations are how the virus is being spread, and unfortunately, when it's spread to the wrong person, it can be lethal. And then lastly, I would say just to keep a positive outlook, to look on the bright side of things. Like we said, it's been almost 1 year that we've been living in this new world.
Yes.
And this pandemic has changed a lot of things, but there has been some silver linings, I would say, for a lot of families, and that families have spent more time together. People that who've had to travel often for work, maybe were home more and got to do more things with their families. It's taken some stress out of our lives in one way, although there's stress in others. I think there's been some silver linings, and I think that if you continue to focus on keeping your family healthy, keeping yourself healthy, and staying safe, doing the right things, that we'll move past this, and we'll all be better for it.
But I hope we do take, like you said, there's been some silver linings, and I hope that we are wise enough and mature enough to take some of those things with us.
Absolutely.
Past COVID.
Yeah.
I know that our family has taken more walks than we've ever had. But what a healthy thing to do after dinner, for you all to be together, put your phone away, leave it at home, and walk together. Take a mile walk together. I mean, it's just so wonderful, and I hope we never stop doing that.
Right.
So really think about those things that you have changed and keep some of them. Think about what you want to keep on the other side. So you've given us so many great things. We take care of our kids so much. They're our priority. They're our pride and joy. But sometimes we forget about mom.
Yeah.
And we forget about dad. So is there anything that you would specifically say to mom and dad? You got to take care of you.
Yeah.
So is there anything specifically you would say to them, just as our last little morsel?
I think that, like we talked about previously, that as parents and as caregivers, if we're more conscious about our overall health and well-being, that will translate into healthy children and how they perceive how well we're doing overall. Stopping bad habits is really important, especially now during the age of a pandemic and when there's a respiratory virus. I think being conscious about what we put into our bodies and how we take care of our bodies is really important as well. Scheduling time for self-care is something that is often hard to do, but it's so important. It's really important because parents need time to recharge, to recoup, to reset, and to give themselves what they need. And so even if it's 10 minutes, a few days a week where you get to watch, read a book or go for a walk, or if there's a great show on Netflix that you've been meaning to start, do it. Give yourself that time when the kids go to bed. And just find something that's enjoyable to you and make sure you're able to provide a little bit of solstice in this craziness.
Yes.
And then lastly, I would say a lot of this has been really overwhelming for adults, and a lot of the pressure is put on us to make sure that the kids are safe and that everything's being done the right way. And I think just asking for help if you need it. If you have someone that your children have been around, or if you have someone that can, take the kids for an afternoon and you can just get out and free your mind, or do something, like you said, go for a walk or a bike ride, just give yourself something. If you have someone that can help you, ask for help if you need it.
And maybe even, because I found, and I adore my children, and so it's my favorite thing is to be with my family, but it's a lot of time together. We've had lots of family time.
Oh, yeah.
So, I personally walk in the morning. That's my thing. Everyone's still sleeping. I get up a little bit early. It's okay that it's a little less sleep, but that helps me just to kind of clear my thoughts and have that time.
Yeah.
But I think that might be nice to share if you have someone you can say, I'll take your kids for an hour and you take my kids for an hour. That's probably a really good idea too, where either you're just sitting in a chair,
Right.
or you're reading a book, or even just catching up on something that you're actually resting your mind rather than the busy. So that's a really great tip.
Thanks.
Good. Okay, well, I think we've got a lot of really great things to think about. I especially like just putting us in the train of thought that we can be healthier, and that's important not only for ourselves but for everybody else around us. And changing our way of life, not just for this month or next month, but these are important things really as we move forward, just
Absolutely.
in general, right? So anyway, thank you, Tara.
Thank
we
you.
appreciate it, and we enjoy talking to you all the time.
Thank
and
you.
actually, you've been requested by many parents.
Oh, really?
So
Well, thank
how
you.
about Tara talks to us? So yeah, this one was for you, all of you who have requested Tara, and I'm
Thank
sure we'll
you.
grab her another time during the year. But we feel safer and healthier already. So thank you so much, and we hope you join us next time. Bye.